Hey, I'm Luke Schellenberg. I'm an ENT doc. I'm not going to be looking at the camera most of the time because I want to show you my CT scan. So I had a CT scan or a CAT scan done of my sinuses back in 2014, and I wanted to show you guys what my sinuses looked like and explain a little bit of the radiologic anatomy of the sinuses. So I'm going to step out here, kind of roll through these pictures here. So our CAT scan or CT scan of the sinuses gives us images in three different planes. The plane that I'm going to use mainly is the coronal plane, or basically the front to the back. And each slice, and I'm working through each slice of that CAT scan, it's like looking inside of a bread. Like if you were to take out one slice of a slice of bread, you could see just what that looks like. And so it's just little images that roll through. So I'm going to get to the very front of the nose, okay? So this is the very front of my nose. And as we go back, we get to the forehead sinuses. These are the first sinuses that we're supposed to see. Sinuses are black. Black is air on the skin. You can see air all around my face. Bone is white, and soft tissue is gray. And so as we go back, we can see these forehead sinuses. They're black. And as we go back, we can start to see the eyes right there and right there. The cheek sinuses are below the eyes, right here and right here. And this scan is a little bit fuzzy. This scan is from 2014 with an older CAT scanner that we had. And so it's not quite as clear as our newer scanners. These tissues right here are called the turbinates. And I talk a lot about turbinates to patients. Turbinates are very important structures, but can cause a lot of blockage. And so a lot of times we will reduce the size of the turbinates surgically when patients are having trouble breathing through their nose. Another thing I want to show you guys is I've got a septal deviation. You can see my septum is not straight up and down, but it deviates quite a bit over to this left side. This is a large septal spur that kind of shoots over into the side of my nasal passages. I'm not going to have a septoplasty because I can breathe okay through my nose though. These right here are the cheek sinuses, or the maxillary sinuses. I've actually got a little bit of sinus disease. Back in 2014 at least I did. That tiny little rim of gray is a sign of sinus inflammation there. Sinuses between the eyes are right here, between the eyes. These are called the ethmoids. And at the very far back of the nose, there's these sinuses called the sphenoids, okay? And I've got bigger sphenoids than a lot of patients I see. Pretty proud of that. It's something that I've been working pretty hard on to grow my sphenoids over time. I'm kidding, you can't do that, but I'm joking. Anyway, this is a CAT scan of myself, and you know, a little bit of interesting findings on it, but a CAT scan is something we frequently will do and gives us really good information. But this is also another plane. This is the axillary plane here. You can kind of scroll. This is from top to bottom, looking down here. And then this is the sagittal plane. The sagittal plane is from side to side. So you can kind of see the structures in three different dimensions and gives us a really good view and helps us to determine surgically what we're going to be doing if we do plan for surgery. CAT scans are really, really important when it comes to sinus disease as far as giving us a good idea of kind of the anatomy or a map. Basically, you kind of can't travel from here to New York unless you know where you're going and how you need to get there. So anyway, that's my own CAT scan. All right.